I rise to speak on behalf of the Greens on the Advanced Care Directives Bill. This bill amends the Advanced Care Directives Act as a response to some of the concerns that were raised as part of the 2019 Lacey Review. The Lacey Review, I understand, was established to assess the extent to which the objects of the Advanced Care Directives Act 2013 are being achieved. The report considered legislative amendments and made 29 clear recommendations to improve the implementation of the Act. There are now some very sensible amendments to this bill. Digital copies are proposed to be included to bring the Act into line with modern practices. Recommendation 5 from the Lacey Review included permitting and promoting the use of digital copies of certified advanced care directives, and the Greens are pleased to see this modernisation of the system and, of course, a reduction in the use of paper. Communities from culturally and linguistically diverse backgrounds will now have the clarity around the use of interpreters to prepare advanced care directives where English is not their first language. There is also a measure that was recommended in the Lacey Review which found that the use of interpreters under the Act is insufficiently regulated and is open to abuse and possible conflicts of interest, both of which undermine the integrity of the Act and the possible validity of advanced care directives. The bill also sets out criteria to refer matters to the tribunal and allows for resolutions of disputes by the public advocate. On passage of the bill in the other place, we note the insertion of new clauses to amend sections 19 and 36. These two amendments attempt to clarify, or rather provide additional clarity around people who have advanced care directives and present to medical practitioners having self-harmed or attempted suicide. We have had stakeholders reach out to us in relation to this inclusion in the bill. They have raised concerns about the potential undermining of autonomy on which the Advanced Care Directives Act is based. One of the issues that they have raised is that the right to refuse health care is fundamental to the Act, and indeed I have considered those concerns in contemplating my position on this bill. On the balance of the information that we have, however, the Greens believe that medical practitioners need clarity around the implications of advanced care directives in responding to medical situations as a result of an attempted suicide situation or self-harm. The bill makes it clear that in cases where a health practitioner reasonably suspects that a person has attempted suicide or self-harmed and that a health professional believes that their health care is necessary to save their life, the provision of the Advanced Care Directive is non-binding. The Greens believe in suicide prevention and believe there needs to be investment in programs to ensure that people who have attempted suicide are provided the support that they need to prevent future attempts. We have always been supportive of the advanced care directives. I think they play an important role in giving people choices around the latter stages of their lives. They also facilitate, I think, important and meaningful discussions within families and within friendship groups around some of those issues. So on that basis, the Greens will be supporting the bill.